I'm a surgical oncologist. I'm Dr. Amani Jambakar, and I'm also certified in cancer genetic risk assessment. And I've gotten a lot of questions about genetic testing. These are some of the criteria for genetic testing and when the insurance will cover it. For people who have Ashkenazi Jewish ancestry plus a family history of breast cancer or prostate cancer or pancreatic cancer, insurances will cover it. If they have a history of breast cancer diagnosed at the age of 50 or younger, and colon and or uterine cancer diagnosed at the age of 49 or younger, usually the insurances will cover it. With ovarian cancer, if your sibling or your grandparent or your aunt had ovarian cancer at any age, that is one of the criteria. Pancreatic cancer, now it does need to be a first-degree relative, meaning that it needs to be a parent, a child, or a sibling that had pancreatic cancer at any age. Male breast cancer and different breast cancers diagnosed at any age are also criteria. So if you have a relative who has had breast cancer in both breasts or has had two different breast cancers in the same breast, then you do meet criteria for genetic testing. We also look at patterns in families. So if you have 3 or more members of your family on the same side that have all been diagnosed with colon and or uterine or breast or prostate or pancreatic or ovarian cancer, or melanoma and pancreatic cancer and astrocytoma brain tumors, then you probably meet criteria for genetic testing. And if you have a personal history of 10 or more polyps on colonoscopy, then you do meet criteria as well. If you don't meet one of these criteria and you get tested anyways, or you do and your insurance denies it, then typically the out-of-pocket cost for genetic testing is a maximum of $249. So at this point, I do have patients who come see me who know that they don't exactly meet the criteria. For example, their mom was diagnosed with breast cancer at 53, but they still want to get tested for their own peace of mind. And if it were up to me, I would recommend everyone get genetic testing because we catch enough unusual mutations when we're not looking for them. And then a lot of people don't know their family histories, or family members are very private about sharing their cancer diagnoses.